Leader's question. I call the Deputy Micheál Martin.
Thank you, Ceann Comhairle. Tánaiste, yesterday, Oireachtas members from across all parties were briefed by the nursing unions in relation to the cynical and overspun announcement in relation to the 1,000 jobs for newly qualified graduates at 20% below the normal rate for such nurses over a 2-year period. And what emerged from the briefing yesterday was quite interesting. First of all, those present were absolutely adamant that no new jobs are being created by this decision, contrary to what the Taoiseach suggested yesterday in the House. That 1,000 agency jobs will be lost as a result of the creation of these so-called 1,000 new jobs. Secondly, the deal was done with absolutely no discussion with the unions whatsoever. Not one discussion, zilch. And thirdly, no alternatives have been examined by the government or the minister or the HSE in relation to savings that could be made more effectively. And suggestions were made that over double the savings could be realised via an alternative route, particularly in terms of VAT and agency fees. Now, nurses across the country see this decision and initiative as a downgrading of their profession. And that is why, and it explains why so few have applied. And apparently we were told up to last week that there were only 30 applicants, hence the decision to extend it back to 2011 and 2010 graduates. Now, interestingly, yesterday as well, the unions were told very clearly, we were told by the unions that the government was told and the management side were told in the context of the extension to Croke Park talks that this was actually a game breaker, that there would be no successful outcome in relation to those talks if this issue wasn't revisited. Now, Minister O'Reilly's intervention in this has added fuel to the fire. He said, and it's written, that basically if nurses and midwives are not happy with this initiative, well, then they can emigrate or work in fast food outlets, which I think was an appalling intervention by the Minister himself, characteristically dismissive and arrogant. What I want to ask you, Tánaiste, is do you agree with Minister O'Reilly's comments that they would be better off emigrating or working in fast food outlets? Could you comment on that? And also, can you confirm, because he also said that this would be extended to physios and occupational therapists, but we were told yesterday that the HSE management and the Department of Finance officials categorically told the unions that it would not be extended to physios and OTs. So could you please confirm this morning on behalf of the government whether it is the government's plan to broaden this out to allied health professionals in the system? And thirdly, can you clarify whether or not you have actually looked at the alternatives that could realise over double the savings that are intended as a result of this particular initiative?
Well, first of all, let's be clear, this is about new jobs. This is about... There are a lot of people who are out of work in this country. This job...
Sorry, will you please? Thank you. This is leaders' questions, and we don't want any interruption.
This government has made it very clear that putting people into employment is our top priority. If a multinational company came into this country and announced 1,000 new jobs for graduates, everybody in this House would be welcoming it. This is 1,000 additional jobs in the nursing sector. There are currently about 35,000 nurses who are employed in the health service at present. This is 1,000 additional posts for graduate nurses, 2-year contract. It's not intended to go beyond that. It's 1,000 for nurses. That's what's intended here, and that's what is being done. It's 1,000 additional jobs. It's about providing employment, additional nurses in the health service. It's better for the graduate nurses, and it is better for the health service to have these in employment.
I'd ask members to please show some respect to the people asking the question and those replying. Thank you very much. No, please get on.
I think it's very important, Tánaiste, that we have clarity and the facts before the House. The union representatives were absolutely adamant yesterday that these do not represent new additional jobs at all, that the clear instructions have been that there will be a cut in the number of agency nurses by 1,000, and that what this represents is a replacement of 1,000 agency nurses by 1,000 new qualified nurses at a reduced rate. That is what is on the table, Taoiseach, and that is the decision. There are not new additional posts, and that is the position. And there's no point in trying to confuse people, mislead people in relation to that fundamental point itself.
Thank you.
Now, I also asked you, Taoiseach, if you would comment on Minister Riley's intervention in relation to this, when he said young nurses should emigrate or go into fast food outlets if they weren't prepared to take these particular jobs. I would ask you, do you think that's an appropriate response from the Minister? Let them eat cake sort of approach that he articulated.
Thank you,
I also asked you, could you confirm whether it was going to be extended to the other allied health professionals or not? Could you please confirm that this morning? And finally, I want to say to you, yesterday Deputy Billy Keller put down a question on this.
Sorry, Deputy,
asking,
way over time.
I will, how many people have applied? And in a new farcical high in terms of transparency from this government, the reply was, it is not considered appropriate to disclose the number of applications received while a public service recruitment competition is in progress. Did you ever hear the likes of it? We now can't tell you how many applied. That's a parliamentary reply.
Thank you.
To Deputy Kelleher. So much for transparency, Taoiseach. What is the bottom line here? This is annoying people. And I would put it to you, Taoiseach, you've been a former SIPTU official yourself. You know this is not the route to go.
Chair, thank you.
And there is very sensible alternatives here. But it now seems that the cause has become bigger than pragmatism or cop-on or common sense. And basically we're going to get this through no matter what, because we put so much in to this initiative. Whereas alternatives are there to be explored that could realise the savings themselves. You should revisit this, Taoiseach, and then make sure that you can actually implement the alternatives that are being offered by the unions.
Thank you.
Well, first of all, at a time of very high unemployment and at a time when many graduates are coming out of college and unable to find employment, I think that the priority has got to be providing employment opportunities. And what this is doing is providing employment opportunities for 1,000 graduate nurses. The current complement of nurses who are in the health service is around 35,000. This additional 1,000 will bring that to 36,000. It is additional posts that are being created in the health service. With respect to the issue of graduates emigrating, what this is all about is providing employment for graduate nurses at home, here in this country, in our health service, which I think is better from the point of view of the graduate nurses themselves, and I also think is better from the point of view of the health service. I think we need to, just be reasonable about this. And being reasonable about it is looking at a situation where there has been a restriction on recruitment right across the public service, as we know. There's an employment control framework. These additional jobs are being created outside of that employment control framework. There is no question of, as you allege, downgrading the nursing profession. That's not being done. I have the height of regard, and the government has the height of regard for nurses, for what they do, and for their profession.
Please.
This is 1,000. This is 1,000 additional jobs. And as for your point about the parliamentary question, I don't think it's unreasonable to wait until the closing date for applications before you say how many people have applied.
Thank you, Deputy Mary Lou MacDonald. Thank you.
Thank you.
I called on Deputy Mary Lou MacDonald.
Thank you, Count Corla. And of course, it can be reasonably stated that the closing date has passed and in fact had to be extended because the young nurses and midwives, the graduates who came and briefed members of the Oireachtas yesterday, along with their union leaders, made it absolutely clear that they will boycott this scam. It's not a scheme, it's a scam. So Taoiseach, this was imposed without consultation. For all your talk of the necessity for agreement and Croke Park Nua, you're setting out in a very deliberate way to slash the wages of graduate midwives and nurses by 20%. These aren't new jobs. It is very clear that 1,000 existing posts within the system will be displaced to bring in graduates and exploit them at 20% less of the rate that they are entitled to. Your claim that this will somehow stem the tide of emigration is really farcical when you consider that across the water in London, a graduate nurse will earn 33,000 sterling. If one of our very qualified graduates decides to go further afield, they'll earn the equivalent of €40,000 and more. So let's not play games here. I understood that whatever about Fine Gael's disposition, that the Labour Party would be committed to a concept of equal pay for work of equal value. I understood, because you keep telling us that you respect the public service and the profession of nursing, and yet all of the evidence stands to the contrary.
Thank you.
You are cynically engineering a situation where young, highly qualified graduates are to earn €22,000 a year. And I needn't say the contrast that that makes with your own pay packet, Taoiseach, and indeed many others across the public and civil service. So I have two straightforward questions for you.
Yes, thank you.
Number one, will you, as leader of the Labour Party and Taoiseach, see that this scam is ended? And number two, can you tell us, please, about the status of this issue in respect of the Croke Park talks? We were told, as the previous speaker indicated, that this matter is on the table and that it will prove to be a game changer, a game breaker for the unions and, crucially, for the young graduate nurses.
Thank you. Taoiseach.
Well, I repeat again that we have a very high level, an unacceptably high level, of unemployment in this country. That level of unemployment is particularly severe among young people. 1 in 4 young people between the ages of 16 and 25 in this country are out of work. There are far too many people who are coming out of college, graduates in different professions, who are unable to find employment in this country. Many of those young people are unfortunately emigrating. What this is about is providing employment opportunities for 1,000 graduates, in this case in the nursing profession. The idea of a graduate entry recruitment scale or salary is nothing new. That is something that is done across the private sector, it is done in the public sector, it has been done on many occasions in the past. This is about providing and creating an additional 1,000 jobs for graduates who will go into the nursing, who will go into the nursing profession. In respect of the discussions on the Croke Park Agreement, I think those discussions are best conducted by those who are involved in them. The discussions are being led by the Minister for Public Expenditure and Reform. They are ongoing, and it is a matter for the participants in those discussions, the trade unions and the employer side, to put whatever issues they wish to put on the table.
Thank you. Deputy MacDonald. 1 minute. Thank you.
The graduate nurses were always going to be afforded an opportunity within the system for the very simple reason that already our health services, our hospitals are understaffed and under pressure. You know that. The difference that you have made here is that you've cut their entry rate by 20%. And the real irony in all of this is that it's not actually about cost savings, because if you were serious about cost savings, you would move entirely away from agency nursing, and you would directly employ people within the system. We all know that that is much more cost effective. But you'd employ people at the proper and the full rate. And just so as members understand, the graduate nurses and midwives are people who have families, many of them have children, they have rent to pay, mortgages to pay, like everybody else. And they are saying to us very, very clearly that they cannot and that they will not carry out these duties at yellow pack rates. Simple as that. And I think it is very depressing to hear a leader of the Labour Party support so fulsomely a scheme, a scam, that is not about new jobs, that's not about any concern for young graduates or stopping emigration, but which is all about driving down the wages of the nursing profession. It's nurses today. Who will it be next, Taoiseach? This scam, is this the blueprint for the health service? Are you intent on expanding this right across the professions?
Well, first of all, it's not about driving down wages. There is no reduction in the pay of nurses. The pay for nurses is not being. No,
Sorry,
please.
just allow the answer, please. Thank you.
Please, you know, again, you come in here. Sinn Féin comes in here week after week, and whatever the issue is, make some allegation that you know, adds more and more to it. There is no reduction. Let us be, no, get the facts. Let's stick with the facts. There is no reduction in the pay of nurses. There is no nurse whose pay is being reduced. What is being proposed here? What is proposed here?
Let's hear the reply. Thank you.
What is?
Would you please allow an answer? We all want to hear the answer. Let's hear the answer. You mightn't like the answer, but let's hear it anyway.
What is proposed here is the creation of an additional 1,000 jobs in the nursing profession for graduate nurses. That's what's being proposed, and it's over and above the existing complement. It's over and above the existing complement of nurses who are employed in the health service. Now, no, please.
If you could ignore it, Taoiseach, I'd appreciate it, because I'll try and control those who are...
Thanks, Ceann Comhairle. You know, Sinn Féin can't come in here one day moaning about unemployment and come in here the next day lashing any proposal that is made to get people into employment. This is about providing jobs for graduates to address the serious issue that we have in this country of the numbers of people who cannot find employment at all, particularly graduates. In this case, in the nursing profession, there are 1,000. Please. There are 1,000 additional jobs being created for nurses. That is what is being done here, and you know, that is. You know, to try and extend it and to try and say it's this or it's that or there's some other agenda. It's simply about providing employment opportunities for people who don't currently have them.
Thank you, Taoiseach. Deputy Matthew McGrath. Deputy Matthew McGrath, who's representing your group, Deputy Higgins. So if you give me a chance.
Ceann Comhairle, I'm standing today on behalf of the technical group, and really I want to follow up on the two previous colleagues who questioned the Taoiseach. And Taoiseach, quite frankly, I know by your body language, your heart is not in the replies you're giving here today. I can remember the Emma Gilmore that I sat behind over there for 4 years, and the righteous indignation that you had with all things that were happening or weren't happening. And we were going to see Labour's way or Frankfurt's way. Is this Labour's way now? To tell deliberate untruths and mischief that 1,000 new jobs are being created. No such thing could be further from the truth. There are no new jobs being created. These are our healthcare professionals who, on a daily basis, literally from the womb to the tomb, we entrust all our families, our lives to these people. They have a vocation. They are highly skilled. And no matter what it is, whether it is the labour wards or the intensive care or emergency wards or indeed palliative care, they look after us with professional and with a dignity. And these are the people that deserve respect from all of us, but above all from the Minister for Health. Not to abuse them like it was quoted in the Business Post of last Sunday by telling them if they don't like it, they can lump it, and they can do yellow pack jobs or pack shelves in supermarkets. This is an outrageous attack by this government on the caring professions. And I didn't even mention the junior doctors and the plight that they're in, being forced to do slave labour, in spite of an EU directive that we have to honour. But it's Labour's way, all right. We ignore the EU directive when we want to. But when we pay the bondholders that you said you were going to burn, it's Frankfurt's way. Taoiseach, it's not, I can see it in your face. I can see it in your body language. You're not happy with this answer today. You know it's untrue. You know that we're trying to sell us porkies over here, and you know that we're not going to buy it. And above all, you know that the people out there aren't buying it, and these nurses and their families and their patients, I might add, who have the height of respect for them in most cases, and I talk for South Tipperary and all over the country and in the hospitals. You know better than anybody else that this is playing games. It's manicuring our figures, which you're very good at. And I would ask you, Taoiseach, what value does this government put on young medical professionals and the people therein? Will this government investigate the working conditions of our junior doctors to ensure that they're not forced to work in breach of the EU directive, as I said, and report back to this Parliament as soon as possible? And will the government reverse the disproportionate attack and with the reduction of the pay for these graduates? These are our caring professions.
Thank you, Deputy.
We don't want them immigrating. It'll be worse than the flight of rebels. And as Deputy Martin pointed out, we got a PQ that was even misleading. You won't give us the number who have applied, because who would apply? When we treat people with this disdain, you'll get the result you look for, Taoiseach.
Thank you very much, Deputy. Taoiseach.
The priority for this government is to get people into employment. We have a rate of unemployment which is far too high. The biggest priority, biggest problem that this country is facing right now, and the biggest issue that the government is addressing, is the issue of unemployment. We have people coming out of colleges, universities, finishing school, who cannot get work. That is an enormous problem for the individuals concerned, and it is an enormous problem for their families, and it is an enormous problem for our society. And we have to address it. And address it we are. And we're addressing it at a number of levels, encouraging inward investment for the creation of jobs, and putting in place a range of measures that will provide employment opportunities and employment experience for people who wouldn't otherwise get it. And one of those ways of doing it is the recruitment of 1,000 graduate nurses in our health service. That's what we're doing. It's about putting people into employment. It's nothing else. That's what's intended here. It's over and above the existing. It's over and above the existing complement of people who are employed in the health service. Currently around 35,000 nurses. This brings it to 36,000. It's additional nurses in our health system, and it's employment opportunities for young graduate nurses who wouldn't otherwise get them.
Thank you, Taoiseach. Deputy McGrath, please. Deputy McGrath is well able to speak for himself.
Thanks, John Kohler. I am. And I know that the Taoiseach is, and always was as well, but coming from the proud tradition of the Labour Party, which was founded in Clonmel, actually, and I welcomed you there earlier this year or last year to commemorate your 100th anniversary. Taoiseach, I'm simply appalled that you would treat nurses, our caring profession. I listened to your spiel about jobs and your 5-point plan and your promises. Yes, it's vital that we create employment. But above all, if we can't care for our young and our elderly and our vulnerable, and if we can't have the respect for our healthcare professionals that they deserve, and to treat them with some modicum of respect and indeed fair play, and we are just displacing agency nurses. We are going to, as I said, less than 30 people have applied for this. People will vote with their feet. They have no faith. If they don't get respect, if they have the Minister for Health, Minister Riley, telling them to go eat cake, or else go pack shelves in the supermarket, that is not the way to treat a Taoiseach. I know you know that. I know that former Minister Shortall knows that, and that's why she's not in the department anymore. This is a con, and somebody called it a scam, but I would call it a sham, and that's what it is, Taoiseach, and I ask you to revisit it for the sake of all the people working in our healthcare professions and our hospitals, and in the community as well. People are under pressure, and they need honest answers, not just spin and manicuring our figures about creation of jobs, which we're getting in all departments, Taoiseach, but above all, this is the most caring profession.
Thank you, Deputy.
They have vocations, and we need to respect them.
Thank you, Deputy. Taoiseach.
Of course.
Thank you. Thank you. I don't want to interfere in internal politics of the technical group, but that's my spokesman for today. Thank you. Back to the spokesman.
Of course we respect, and I respect, and the government respects the people who work in our health services. They do a fabulous job, and they're doing a fabulous job in very difficult circumstances. There's increasing demand on our health services, and they have to do the work that they do with less resources and, in many cases, with less people. What this proposal is about jobs. That is our top priority. It's about getting people into employment and to getting employment experience. 35,000 nurses in the system at the moment. This brings it to 36,000. These are additional posts for graduate nurses. And you know, at a time when there is so much unemployment, when there are so many young graduates who can't get work at all, I think that members of this House should be welcoming the creation of jobs rather than coming in here and complaining about it.
Thank you, That completes leaders.